In 2013, the prestigious Journal of Patient Safety published a study that as many as 440,000 patients die each year from preventable medical errors. That would make medical errors the third leading cause of death in America, behind heart disease and cancer, which is second. These people are not dying from the illnesses that caused them to seek hospital care in the first place. No, they are dying from mistakes that hospitals could have prevented. What are these fatal errors? Who are these incompetent and negligent doctors? A New England Journal of Medicine, January 28, 2016 study reported that 1% of physicians accounted for 32% of paid malpractice claims over the last 10 years. The ugly truth is that little is being done to hold these dangerous doctors accountable. Researchers found that bad doctors showed distinctive characteristics, including having paid previous malpractice claims. So it stands to reason that healthcare providers could eliminate 1/3 of medical malpractice along with patients' pain and suffering, as well as the added cost of corrective surgeries, long-term care, and indemnity payments by removing the worst 1% of doctors. Why aren't bad doctors stopped from practicing? The answer lies, at least partially, in the National Practitioner Data Bank, a clearinghouse for information on medical malpractice that Congress established in 1986 to help state licensing boards police the healthcare industry. The national database was supposed to help states identify dangerous doctors and prevent them from harming more patients, and is used by hospitals, insurers, and licensing boards to track doctors' records, check prospective hires, and make other decisions. But it is virtually useless in holding doctors accountable because, by federal law, none are listed by name. They are assigned a random number to protect their identities. Even if doctors were identified in the data as they should be, the public would still be barred by law from accessing the records. So vulnerable, sick patients sit in the waiting rooms of bad physicians without a clue about their poor record of performance. And in many cases, a negligent doctor's insurance company pays the victim of malpractice and the doctor goes back to work. If a doctor develops a bad enough reputation in one town, he can move to a new state and continue practicing. This is unbelievable. But today, the public does not have access to the database to identify doctors' names and addresses, to identify doctors with uniquely long histories of being sued or disciplined for medical malpractice. Because on September 1st, 2011, the government cut off public access. What was behind that decision? Apparently, one Kansas doctor with a trail of malpractice suits, Dr. Robert Tenny. The Kansas-based doctor complained to the Government Health Resources and Service Administration that the Kansas City Star newspaper was publishing the story of one of his patients, Maribeth Chase, who died in 2007 after undergoing a brain surgery with Dr. Tenny. It is also noted that Tenny has been sued at least 16 times for medical malpractice, but had never been disciplined by the state's licensing boards. The Insider Exclusive produced a TV story on this case with the lawyers who represented Marybeth's family when doctors go bad, Maribeth Chase versus Dr. Robert T. Tenny. Tenny finally settled the Chase family's wrongful death suit for $1 million. The settlement brought total malpractice payments paid on Tenny's behalf since the early 1990s to roughly $3.7 million. In some states, including California, Colorado, Georgia, and New York, patients can go to medical boards' websites to find out about doctors' malpractice histories, but not in Kansas and Missouri. In this Insider Exclusive Network TV special, Justice in America, Mary Hendon's story, we visit with Mary's lawyer, Lloyd Bell, founder of Bell Law, as we take you inside today's legal system, examining his legal strategies and in vivid detail showing you the often heartbreaking stories of medical malpractice cases like Mary's. Here's Lloyd Bell to give you an insider's devastating critique of modern medical practices and an honest view of what our broken healthcare system looks like.
The reality of patient care today is there is room for significant concern. There was a study that came out recently from Johns Hopkins University, which found that of all the causes of death in America each year, medical malpractice accounts for the third leading cause of death. Medical malpractice, that's the equivalent of 2 jumbo jets loaded with passengers crashing every single day of the year. That is unacceptable in a modern country, a successful country such as the United States. So the reality is that there's a real problem out there. So roughly 1% of doctors cause about a third of all medical malpractice cases in America. 1%. So why aren't they being pushed out of medicine? Why aren't they being drummed out of the profession? And the answer to that is, I believe, part of it is politics. These are professionals who have their licenses, and they fight very hard to keep their licenses. And another reason that these doctors are allowed to continue practicing is they can move around. They can move from state to state. So if they get held accountable for medical malpractice in Georgia, they can move to other states in the country that have different laws that may be willing to allow them to practice. So it's a real problem. And the biggest problem is that patients don't know this. They don't know who those doctors are. You know, doctors are humans, just like all of us. And like human beings, we all make mistakes, including doctors. But there's something about a medical mistake, a professional mistake, that so many doctors are reluctant just to say they're sorry, just to look the family in the eye and say, I am very sorry, I made a mistake. It's hard for anybody to do that, but I have seen that it's extremely hard for a doctor to do that. And it's unfortunate. There have been studies that have come out that prove and demonstrate that if doctors will just accept responsibility and admit their mistakes, that families and victims of malpractice are far less likely to sue. As more and more hospital groups are acquiring smaller doctors and more doctors are practicing together, it seems like communication between the professionals is decreasing. People will communicate, doctors will communicate through electronic medical records, but they don't talk to each other like they used to. They don't pick up the phone and say, Dr. Jones, I see you sent this patient to me for this reason. What's going on with this patient? Talk to me. They don't have the face-to-face communications like they used to. They essentially hide in the computer. They hide in the medical record. And they say, well, if I put it into the medical record, the people that need to see it will see it. So the lack of communication is a real problem among the professionals. Another big change that needs to happen is a movement away from this assembly line factory mentality of caring for patients. Some doctors, primary care doctors, will see 60, 70 patients in a day. You can't see that many patients in a day. You can't even barely get to know somebody's name with that many patients in a day. The old days where a doctor would actually sit down with the patient, look them in the eye, tell me what's going on, spend time with them, get to know them over a period of time. It just doesn't happen as much as it needs to. So that's another change. There needs to be greater communication. There needs to be more time spent between the doctor and the patient. One last thing I would offer as well is there needs to be less reliance on other specialties to do your job. If you're the doctor and you're caring for a patient, that is your patient. And it's good to involve other specialties. That's helpful, that's needed sometimes, but that's still your patient. And too often, patients will be sent from Dr. A to Dr. B to Dr. C, and each of those doctors along the way will look at that patient through their specialized lens and not look at the whole patient. So it kind of ties into a lack of communication, but it also is a siloed kind of thinking, where every specialist looks at the patient through their specialty lens and doesn't look at the whole patient. And patients fall through the cracks that way, and they don't get the care that they need.
This is the Insider Exclusive, live from Atlanta, Georgia. It is my great pleasure to introduce Lloyd Bell to the show. Welcome to the show, Lloyd.
Thank you. It's great to be here.
Tell our audience a little bit about your practice of law. It seems like you do a lot of medical malpractice cases. Why?
I do a lot of medical malpractice cases. I've been practicing now for about 20 years, and I come by it rightfully. My father was a doctor. He was also a lawyer, and he sort of opened me up to the need for medical malpractice lawyers who are willing to take on these cases. These cases are extremely challenging, they're expensive, and they require a specialized interest in medicine. And on a more personal level, my brother was a victim of medical malpractice. He was a service member, and he served in Iraq, he served in Afghanistan, and was exposed to the chemicals in the atmosphere, and he developed lung cancer. And he came back to the States, and it was not diagnosed by the Veterans Administration for many, many months. They didn't give him the appropriate tests. And at the age of 53, he died of lung cancer. Medical malpractice is very personal to me, and I'm very committed to the victims of malpractice and trying to help them obtain justice.
Today we're here talking about the Mary Hendon case. Tell our audience a little bit about who Mary is and what happened to her.
Mary Hendon is a lovely lady in her early 60s. She's been married to her husband, John, for almost 40 years now, and they retired to the North Georgia mountains to run a small lavender farm, what they call a craft farm, just for pleasure and fairs. But she had some chronic neck pain, and she went to her doctor to have it looked at, and the doctor recommended she get a series of epidural injections. Now, these injections are injected into the back of the neck, what they call the cervical spine, and a little bit of medication, steroid, is injected around the nerve, and this helps with inflammation and helps with hopefully alleviate the pain. And these are very common. They are generally administered in series of 3. You have one day, you come back for the following 2. But they carry with them some significant risk because you are sticking a very sharp object next to a very important structure, which is the spinal cord. And it's very important that that needle does not go too far and stick into the spinal cord, as you can imagine the problems that could result. Well, in Mary's case, she went in, and the doctor who was doing the procedure and actually doing the injection, that doctor relies upon the nurse anesthetist to put Mary in the correct level of sedation, to put her asleep to a point, or to put her in sedation to a point, but not put her completely asleep. The reason is, if that needle goes too far and hits the spinal cord, the patient needs to be awake and alert to be able to tell the doctor, hey, that hurts, so that the doctor doesn't inject the medicine into the spinal cord. Extremely important that the nurse anesthetist get it right. If the nurse gives too much medication or gives the wrong medication, they can really put the patient at risk, and that's exactly what happened to Mary. The nurse anesthetist gave the wrong sedation, something called propofol, which is a very potent sedative. He gave too much of it, and he put Mary into a deep state of sedation where when the doctor put the needle in and impacted or touched her spinal cord, she didn't have any response. He injects, and now she has suffered permanent neurological or nerve damage that affects her entire life.
And what has been the result of that? What can she do now?
She lives with chronic pain. She has numbness and tingling down her lower legs. She has bowel and bladder issues. She has difficulty walking. It has literally changed every part of her life, and it's been devastating.
If I remember correctly, in the summary you gave of the case, the nurse who was administering the drug,
Nurse Smith,
did not measure the amount of anesthesia that she was giving Mary, correct? Are they supposed to do this? I mean, they said they didn't keep a record.
Well, they kept a record, but they didn't keep details within the record that they should have kept. How much the medication they were given to her at which time. But even more important than that is to make sure they don't use this medication, propofol, for somebody like Mary. It is completely against the standard of care to give propofol, which is a very potent, deep anesthesia medication. Don't give that to somebody like Mary at her age and with the type of procedure she's having. It's an elective procedure. This is not required procedure for to save her life it's to help her with pain. And the first order of all doctors is first do no harm. And they certainly caused some harm with Mary. That's going to last her entire life.
Now, this trial is supposed to go to trial in 2020, next year.
It will.
So what do you have to prove, and how do you prove this?
Well, we carry the burden of proof to show that the Nurse Smith's conduct fell below the nursing standard of care for nurse anesthetists, for other nurses like him. So we have experts. We have an expert physician who supervises nurses like him. We have this expert testimony that says, number one, don't use propofol, and number two, is the nurse anesthetist's responsibility to make sure the patient's in the right level of sedation. And if he doesn't meet that responsibility, which he did not in this case, then he is responsible for the harm that he has caused to Mary, which has been devastating.
And that nurse is an employee of the hospital, is that correct?
He's with an outside group. He's with a separate outside nurse anesthetist group.
But is the hospital also named as a defendant?
The doctor who did the procedure is not affiliated with the hospital. He's not an employee of the hospital. He has his own practice. The doctor was also part of this lawsuit, the claims against him have resolved. So the case remains against the nurse for his violations.
When you say they resolved, does that mean that based on his medical malpractice insurance, it covers situations like this?
There was a confidential settlement with the physician because he did some things wrong too, which we filed a lawsuit about.
Is he being used in a case against the nurse?
He'll be called to testify in the case, absolutely.
And the lawyers that represent the nurse are aware of this?
Absolutely.
And they're still going to trial?
As it stands today, we are still going to trial.
That's amazing.
I agree with you. It is amazing.
Since you are well known for getting successful verdicts and settlements in medical malpractice cases, a lot of people will contact you. How do you determine the cases that you want to handle?
Well, unfortunately, we can't handle every case that comes to us. We have to focus on the types of cases that we are best equipped to handle. So the first question we look at is, what has been the outcome of the supposed malpractice? Unfortunately, it has to be a catastrophic injury or a wrongful death. So that's the starting place. What's been the outcome? We see a lot of cases of medical malpractice where the potential client will approach us and explain a horrible situation they've been through, but if they've had a full recovery, that's not a case, unfortunately, we can take on. So we look at the injury, and then we get the medical records, and then we examine the medical records. We have a medical staff that's available to us to review the records, and we kind of put on our Sherlock Holmes hats and start investigating and start digging, and then we go through that process. We tell our client every step of the way what we're discovering, and then ultimately we have to make a decision. Is there malpractice? If yes, is it a case that we can proceed? And if it's not, we have a wide network of attorneys we refer cases to. But if it's a case that we take on, then obviously we'll bring all our resources into that case.
Good. Well, good luck with this case, and thank you for being on the show.
Thank you for having me. It's been a pleasure.
Thanks for joining us. You can get more information about our guest and the issues at insiderexclusive.com.